Good morning, everyone, and welcome. Today, we're going to take a deep and comprehensive look at feeding and eating disorders. We'll explore these complex conditions from multiple angles: historical, biological, psychological, and sociocultural, giving us a broad understanding of their roots and impacts. We'll also discuss various treatment approaches to better understand how to support those affected. I'm excited to dive into this important topic with you. Eating disorders are more than just unusual eating habits. They're complex conditions influenced by cultural, psychological, and biological factors. These disorders actually have a long history, documented over centuries. Interestingly, in ancient times, behaviors like purging and fasting were often seen as ways to promote health or spiritual purity, which shows how deeply ingrained these practices are in human culture. Understanding this historical context helps us see that eating disorders are not new phenomena, but rather conditions shaped by evolving beliefs and influences over time. When we look at the development of eating patterns, the first thing to note is that young children often become picky eaters. In fact, about 1 in 4 kids under 12 are considered picky, which can set the stage for future eating behaviors. Around the age of 9, societal norms that emphasize thinness start to impact children, especially girls, increasing their anxieties about weight. These pressures come not just from media, but also from family and peers, shaping how children view their diet and appearance. On a biological level, our metabolism and what's called the set point, an internal regulator of appetite and weight, help maintain balance and resist drastic weight change. However, when early dieting patterns take hold, along with dissatisfaction about body image, there's a risk these behaviors can escalate into eating disorders. Chronic dieting may trigger harmful cycles of restrictive eating, binging, and purging. These cycles are reinforced by biological factors like a slowed metabolism and psychological responses, such as the false hope syndrome, where individuals repeatedly try and fail to lose weight. By understanding how these biological and psychological feedbacks interact with development, we gain important insights into how eating disorders arise and persist. Childhood obesity is measured using the body mass index, or BMI, which is a ratio of weight to height. Specifically, a child is considered obese when their BMI is above the 95th percentile for their age and sex. This means their weight is higher than 95% of their peers. It's a significant issue, impacting roughly 1 in 6 children in North America. This high prevalence highlights the importance of understanding and addressing the factors that contribute to childhood obesity. Early feeding disorders are conditions that begin in infancy or early childhood and can significantly impact a child's growth and development. Some of the main disorders we see include avoidant or restrictive food intake disorder, or ARFID, which is characterized by a persistent failure to meet appropriate nutritional or energy needs, often due to a lack of interest in eating or avoidance based on sensory characteristics of food. Another disorder is pica, where children repeatedly eat non-food items, which can be harmful and requires careful management. Lastly, failure to thrive, or FTT, refers to a condition where a child does not gain weight or grow as expected, often due to inadequate intake or absorption of nutrients. Understanding these disorders early is crucial for effective intervention and support. Here we have a detailed breakdown of anorexia nervosa. First, the core feature, criterion A, involves a restriction of energy intake that results in a significantly low body weight, which is a major health concern. Next, criterion B focuses on the intense fear individuals have of gaining weight or becoming fat, which often drives their restrictive behaviors. Criterion C highlights the distorted perception they have of their own body and how this impacts their self-evaluation, often leading to an unhealthy self-image. There are 2 recognized subtypes: the restricting type, where weight loss is achieved primarily through dieting and exercise, and the binge eating or purging type, which includes episodes of binge eating or purging behaviors like vomiting. Lastly, severity is categorized based on BMI percentiles, ranging from mild to extreme, helping clinicians assess the level of intervention needed. Understanding these key criteria is essential for identifying and treating this complex disorder. Bulimia nervosa is characterized by several key criteria. First, individuals experience recurrent episodes of binge eating, during which they feel a loss of control over their eating. To prevent weight gain, they engage in inappropriate compensatory behaviors, such as purging or excessive exercise. These binging and compensatory behaviors occur at least once a week for a minimum of 3 months. Additionally, a person's self-evaluation is heavily influenced by their body shape and weight, meaning their sense of self-worth is closely tied to these factors. Importantly, these symptoms are not exclusive to anorexia nervosa. They occur independently, defining bulimia as a distinct disorder. Binge eating disorder, or BED, is characterized primarily by recurrent episodes where individuals eat a large amount of food while feeling a loss of control. During these episodes, people often eat very quickly, consume food even when they're not hungry, and tend to eat alone due to embarrassment or shame. One key aspect of BED is the significant distress that these binge episodes cause. It's not just about the eating itself, but the emotional impact that follows. For a diagnosis, these binge episodes need to happen at least once a week for a minimum of 3 months. Unlike bulimia or anorexia, BED does not involve compensatory behaviors like purging, fasting, or excessive exercise to counteract the binges. Understanding these criteria helps us identify BED accurately and differentiate it from other eating disorders. When we look at the causes of eating disorders, one major factor is genetics. Studies show that relatives of people with eating disorders often have a higher risk themselves. This suggests that certain inherited traits, like emotional instability or difficulties with self-control, can make someone more vulnerable to developing these disorders. Another important aspect involves neurobiological factors. For example, issues with serotonin regulation in the brain can impact both appetite and mood. These imbalances might contribute to the persistence of disordered eating behaviors, making recovery more challenging. Understanding these underlying causes is key to providing effective treatment. When it comes to treating eating disorders, there are several key components we focus on. Treatment typically combines psychosocial therapies with family involvement, and sometimes medication is used as well. One of the most effective therapies, especially for bulimia, is cognitive behavioral therapy, or CBT. This approach helps patients challenge and change distorted beliefs about their body image, regulate their eating habits, and importantly, work to prevent relapse. For adolescents with anorexia, family therapy plays a crucial role. This approach looks at how family communication patterns affect the disorder and actively involves parents in supporting their child's recovery. On the medication side, pharmacological interventions like selective serotonin reuptake inhibitors, or SSRIs, may be prescribed to manage related issues such as depression or anxiety. However, these medications are generally not the first choice for treating anorexia itself. Most treatment happens on an outpatient basis, focusing on early intervention and addressing family dynamics. This approach integrates nutritional guidance, psychological support, and medical care, aiming to support a lasting and comprehensive recovery. This chapter offers a thorough overview of feeding and eating disorders, exploring everything from the development of eating behaviors to childhood obesity, early feeding challenges, and major eating disorders in adolescence. We also delve into the key factors that influence these conditions, including cultural and biological aspects, as well as psychological and social risks. Family dynamics and sociocultural influences play a significant role as well. When it comes to treatment, options mainly involve psychotherapy, engaging the family, and sometimes targeted medication. To support your learning, there are study resources available that summarize important sections on eating patterns, obesity, infancy disorders, and adolescent eating disorders. Finally, make sure to familiarize yourself with important key terms like anorexia nervosa, binge eating disorder, purging, and metabolic rate. They're essential for a deeper understanding and effective review.